of University of Minho. He has been an online counsel since 2004 and has published a monograph, textbook chapters, and articles on e-counseling. So, Jan, if you are ready, you can share the presentation and start.
Obrigada, Cristina. Boa tarde a todos. My remarks will be in English, as is the style here. Thank you for the privilege of presenting in English. My name is Yaphe, and I'm a family physician. As Cristina said, I've been privileged to work at the University of Minho since 2007, but I've also been an online counselor for 2004. I've been teaching in community health with my colleagues, many of whom are here today, and now I'm part of the health services science branch of the medical school, and my research is done in the population health domain of the ICVS. I'd like to thank Margarita Coronevich for the invitation to present this. She spoke to me back in December, so I've had about 4 months to think about this and prepare it, and I've enjoyed it thoroughly. It's given me a chance to think about my clinical work, and so I'm happy to share this with you. Can you see me and can you hear me?
Yes,
okay,
yes, I think it's okay.
And you can see the slides. So I'd like to start by telling you a story, and Christina's informed me that I have a half an hour to share with you, so to leave plenty of time for discussion, and I'll respect that. So over the next 30 minutes, we'll enjoy some new material. But as I say, I'd like to start with a story, and this is the story of Barbara, who I met in April of last year. At the time, she was 27 weeks pregnant, and she's a 27-year-old surgical nurse who's married to Tom. Now, I've changed some of the names and the clinical details to preserve anonymity, but we'll call her Barbara. She's a nurse working in a busy surgical ward in a general hospital. And in terms of past medical history, she suffered a fetal loss. It's a spontaneous abortion at 17 weeks gestational age, about a year previously. That was in 2019. She also had a previous history of depression following the death of her father. Father died early in her adolescence, and she received from counseling for that. And she had some counseling following the spontaneous abortion in 2019. So again, when I met her, she was 27 weeks pregnant, and she was feeling conflicted about leaving her work as a nurse, and because she had fears for her own health and for the health of the baby. So just to summarize this in a genogram, which you're all familiar with, Barbara is our index case, 27 years old, married to Tom, spontaneous abortion at 17 weeks in 2019, and 27 weeks gestation in April of 2020. As the cycle figure goes, she had good support and a strong relationship with her mother, and a good support and strong relationship with her husband, and her father was deceased, as I mentioned. So what were Barbara's concerns? She asked, is my baby safe? Can I work? Can I take time off work at a time when my services are needed so much? And will I lose time for maternity leave? She had planned to take off a year to be with the baby, but she was afraid that if she took time off early because of other concerns, she would lose time after the birth of the baby. She expressed her wishes quite clearly. She said, my wish is to have a stress-free, happy, enjoyable third trimester while minimizing my risk for contracting COVID-19, to have a safe, healthy delivery of the baby with no separation from the baby at birth, to have my husband present for the birth, and to have my extended family fully included in meeting the baby and supporting us as new parents. As well, I want to have minimal anxiety postpartum related to COVID-19. So counseling with Barbara then focused on looking at her strengths and her resources, looking at how she coped in the past, asking her how she saw herself getting through this, helping her to figure out what she wanted, and helping her to figure out how to ask for it. And to do this, I used the CARE model, which I'll explore a little later with you. How she saw herself getting through this. So, sorry, someone's microphone is on and is echoing. So if you
I think
don't
it's
mind.
okay now. Already off.
Okay, thanks. Okay, so again, we use the CARE model, and the letters refer to connect and contain, assess and affirm, reorient and reaffirm, and encourage and empower. And in Barbara's case, this would mean that this COVID situation by April was familiar to us, and was seen to be manageable. In terms of assessing her strengths, she had coped with losses before, and we wanted to affirm that she could cope with this again. In terms of reorienting or reframing her situation, she was presented with choices. And once she made her choice, she was told, "You've got it, you can do this, keep going." At the end of counseling, Barbara was able to say that I can focus on what I can control, accept the rest, and go with the flow. I can allow myself grace to be where I am and not compare myself to others. I can remember that I am in control of who I am, how I feel, and how I react. I understand the importance of exercise, including walking and workouts, and I can set time for spirituality and remember that I already have everything that I need within me. And finally, when counseling ended, Barbara was able to say, "Thank you for your caring response. I feel like our work has gotten me to the point where I'm ready to close the session," is reassuring that I will be able to re-register in the future if I feel I need it. Thank you for your time and warm wishes. Well, it's a nice ending, but it's important to remember that I never met Barbara. I never saw her. All this was conducted online in a series of 4 encounters. This was all text-based, asynchronous, electronic counseling. That's quite remarkable when you consider that counseling is a universal component of medicine, but the medium then is the message. And it's important to consider this medium given the context of the coronavirus pandemic. So what does this talk about? Well, it's about e-counseling. What is text-based electronic counseling or e-counseling? And your obvious question is, does it work? And then if it does work, how does it work? You might be interested to know who uses it. And specifically, how can we use this method to help people cope with the stresses of the current pandemic? Well, to give you a little background, which may be familiar to many of you, and I want to thank our colleague Dos Santos from Pedro Morgada's group for a wonderful review of mental health in the pandemic, but I did my own review and found many references that you may be interested in. I'll be happy to share them with you because I have them full text. Sheldon, in a survey in the UK early on, found increases in both anxiety and depression as a result of the pandemic. The WHO, in a recent publication, talked about the shadow pandemic, which is an increase in domestic violence during the pandemic. Duarte in Portugal has identified professional burnout in healthcare workers coping with coronavirus. Usher has looked at social isolation worsening mental health as a consequence of the confinamento or lockdown. Guignard in France has documented an increase in substance abuse, while Titov in Australia has showed that there's been an increase in telehealth services that are available during this challenging period. And Moreira, again in Pedro Morgado's group, and I'd like to shout out a word of congratulations to him on his recent successes, has showed how access to mental health services during the pandemic is protective for the increases that they found in their research in anxiety, depression, and specifically symptoms of obsessive compulsive disorder, which is their special research interest. So given that background, I'd like to tell you about an employee assistance program that I've had the good fortune to be associated with since 2004. Now, this is a service that's given to the employees of small and large corporations in Canada and also internationally. And every person who's employed by these companies that signs up for it is entitled to in-person, telephone, video, or written counseling. Now, the number of sessions that the person will receive is determined by the insurance package that the company buys. But the written package allows people to have confidential, password-protected, encrypted consultations with a counselor through an online platform. The counselors who work in this service are psychologists and social workers who are licensed and registered with their local corporations. I'm the only physician currently on the team of 50, but they're master's or PhD level counselors who are experienced in their fields. Now, initially, back in 2004, this was a 4-session model that was offered to employees, but now it's a more flexible model, and I'll show you what this concept of a session is and how it can be used to deliver counseling online. My own personal experience, as I mentioned, goes back 17 years with this company, and I've now accumulated a case file of over 3,000 cases. With the help of my colleague Cedric Spare in Canada, who originally got me involved in this exciting project, we've managed to publish several textbook chapters, some scientific articles, and a recent monograph published in Oxford, England, by Routledge in November, which detail our experience with this project. And we've also talked about how we can supervise counselors and train them in this new field. My own personal CV in this, you don't have to read this slide, but I'll be happy to share this presentation with anyone who's interested and share this CV with you, this list of publications. And if you click on these hot links, you can get the full text of these articles that talk about techniques of e-counseling, how to supervise workers in the field, and how to apply different techniques, for example, in the management of chronic disease. So this is available to you if you're interested. Well, what are the advantages of e-counseling? It certainly is accessible as your laptop or your table-based computer, and we're more locked down on the pandemic. Access is a key issue. It's private, it's confidential. If you save your exchanges with your counselor, this gives you words to hang on to. We've also found that there's a disinhibiting effect of talking to your counselor from a distance. People may say things online in a private letter to a counselor that they may not say in a face-to-face meeting. Now, there's no pressure in an asynchronous form of conversation to provide an immediate answer as you would have to in a face-to-face conversation. This gives you time for reflection. And we speak of composing oneself in writing. As you compose the letter, you compose yourself. The client also has, or the patient has, ownership of the text. The doctor can't interrupt the patient as they're delivering their monologue. But there are also disadvantages of text-based counseling, as you may imagine. It requires computer literacy and access to a device which can connect to the internet. Also delays, because this is asynchronous, and we offer a reply within 48 hours, but patients may imagine all kinds of things, may feel rejected, may feel ignored until the reply arrives. So this may produce misunderstandings. In addition, there's a loss of touch, eye contact, and nonverbal cues. However, each of these disadvantages also contains an advantage, because text may also contain nonverbal cues, which are important. So like the person who shouts using all capitals, we can read between the lines and detect the emotional tone of the client from their text. Text also allows us to cut to the chase and zoom in or hone in on the central elements of counseling. And we can avoid distracting elements that may be present in in-person visits. The blank screen also allows the patient to project their feelings, needs, and wishes onto the page, much as in old-time psychoanalysis, the patient lies on the couch and stares up at a blank ceiling and project all they want onto the ceiling without looking in the face of the counselor. So again, to get back to the care model that we use in counseling, the C refers to connect and contain. And we can say in text that your problem is human, is familiar, and it is manageable. When we assess the client and affirm their strengths, we're saying to them, you've got what it takes to get through this. When we reorient or reframe and reaffirm, we tell people that they are not defined by their life situations. We all fall down sometimes, but we're not defined by that. However, we may be defined by the ways that we get back up and keep going, and that's what we're helping people to do. And when we encourage and empower clients, we tell them, you've got it, keep going, take one step at a time, you're on your way. This appears in a longer article in text on text-based and online counseling that appeared in 2010. What I did for this project is to look at the cases assigned to me in 2020 and try and summarize them to find out who the people are, the problems or issues they presented, and how they were dealt with and what the outcomes were. So I abstracted the data from my case files and looked specifically in the numerical sense at age, gender, industry, occupation, presenting issue, number of sessions, duration of counseling, and whether or not the issue presented was related to the COVID pandemic. I also looked at outcomes by doing a qualitative analysis. I did some simple statistics on the material I collected and did a qualitative analysis of the text using grounded theory, which I'll explain a little later. So just one slide of the numbers. I was assigned 249 new cases in 2020. The mean age of patients was 37.4 years. The range of ages was 15 to 64. Again, this is a working population, but some dependents of workers were entitled to use the service. 69% of the clients were female. They represented 32 industries and 41 professions, and obtained about 2.5 sessions per client with a range of 1 to 14. The client who got 14 sessions was involved in a child protection case, which was quite complex and required an extension of the usual counseling framework. Counseling occurred over a mean of 25 days with a range of 7 to 129 days. And this special group of global clients who work for multinational corporations all over the world formed about 10% of my patient population last year. When I looked at the content of counseling, only 25% were directly related to COVID. That means that 75% or 3/4 of my clients were getting on with their lives and dealing with the other normal misery that we have to deal with in our daily lives, in relationships and so on. And I'll talk about the range of problems, but it's particularly interesting to see this 25% of patients who had COVID-related issues presented to counseling. I'll go through this in a little graphic format. Again, the age range of 15 to 64 with a mean age of 37, 69% female. In terms of the industries represented, patients came from government, health, education, retail, social services, banking, energy, communications, construction, and many others. The professions represented included managerial professions, sales, secretaries, social workers, teachers, students, technicians, accountants, nurses, and even university professors. This is a graph of the range of sessions provided from 1 to 14. And in terms of the presenting issues, most were related to personal stress. This related to family, other issues from life, past abuse, and so on that we classified as personal stress. There were also many with couple or relationship issues, anxiety, depression, workplace stress, medical issues, grief, divorce, anger, and again, many others of lower frequency. When I looked specific, the medical issues presented to me, and again, there is a selection bias here because as the only doctor on the team, the support staff will tend to assign cases with a medical flavor to me. 7 of the cases related to cancer, either in the person, but mostly in the family of the client, related to obesity, back pain, fibromyalgia, inflammatory bowel disease, irritable bowel syndrome, addiction, pregnancy. That was the first case I described to you, diabetes, ischemic heart disease, and 12 other medical issues. When I looked at the clients who came back after the first exchange, after registering and receiving my first reply, those who came back, 96% were judged to be improved at the end of counseling sessions. Only 5 were unchanged or worse, which is 4%. I did a little fishing expedition, and although this isn't quite kosher because I didn't have the hypotheses a priori, and this wasn't a rigid sampling frame, it was a convenient sample of 1 year of counseling, but I did try some tests to try and generate some hypotheses for future research. A positive outcome, including the patients who didn't come back, so it's kind of like an intention to treat analysis. An association, a positive outcome was found with a strong association with COVID-19 related complaints. Gender and age were not associated with positive outcome, but the number of sessions and the duration of sessions the clients stuck around for was associated with a positive outcome. So being engaged in counseling suggests that it is related to good outcomes in the end. Now, I'd like to leave the numerical data and look more at a qualitative analysis of the text using grounded theory based on the method proposed by Glaser and Strauss in '67, in which you immerse yourself in the text, you identify passages of interest, you highlight keywords with a colored marker, whatever method you like to use. Using those keywords, you try and group them into categories and find a descriptive title that matches the category you've created. You keep reading the text until the categories are saturated and you can't find any more examples of what you believe is a category of text. Then you try and look for categories, connections between the categories, and create a model that begins to explain what you have found. So the categories arising from the text from this reading of these 249 e-counseling cases refer to emotional issues, including anger, anxiety, depression, grief, and personal stress. Some clients talked about the benefits of lockdown. Many clients came to counseling for relationship issues that included couple conflict, separation, divorce, or domestic violence. Family issues included childcare, elder care, isolation, financial stress, and care of sick relatives. The health effects of the pandemic included addiction, eating disorders, access to care, and work-related issues included workplace stress, work-life balance, or working from home. I'd like to share some of the direct quotes from the text that falls into these categories to give you a flavor of the words that people use. So a 26-year-old female working in sales says that she feels extremely anxious about the pandemic. She can't sleep due to panic attacks. She feels unwell. She recognizes that it's beginning to impact her work. A 49-year-old male who is listed here as a civil servant began to experience high levels of stress and anxiety during the pandemic, not feeling well in the past week, feeling nauseous, losing appetite, having pain in the stomach, feeling lightheaded, feeling that my body controls me rather than my mind, and feeling weak. Again, the care model was used to approach patients presenting with symptoms of anxiety, and patients were reminded that their response to this threat was perfectly normal. I use psychoeducation explaining the role of adrenaline in producing their symptoms and explaining the meaning of their somatic complaints. Many of these can be managed effectively with medication, so patients were encouraged to maintain contact with their usual source of medical care to determine if medication were appropriate. And I warn people that I will not make diagnoses or prescribe medication by email, so they were encouraged to maintain contact with their usual source of medical care. The emotional concomitants of anxiety were managed with counseling, and patients were also referred to therapy when necessary, given links to local sources. They were reassured that the cognitive aspects of counseling of anxiety were often effectively managed by cognitive behavioral therapy, and they were provided with relevant reading resources to help them start this on their own. For some special patients, we were able to explore the existential meaning of symptoms, including the meaning of the situation to the person, because finding meaning is often a good way of coping. So a 36-year-old male who presented with anxiety symptoms wrote at the end, "I started this online counseling because I felt the urgency after how I was responding to the reopening of his business. The immediate crisis had passed. I've had appointments with my regular therapist and my family doctor, so I'm happy how my care will continue long term. This feels good. I've really appreciated this." And this client is then outlining the bridge over troubled water aspect of the bridging effect of e-counseling and helping people to find other long-term sources of counseling, but e-counseling was there to help them cope in the short term. Anger appeared as a presenting issue for many clients. For example, one 34-year-old secretary says, "Staying at home 24/7 has turned me into a wild beast. I'm only able to cope with my big feelings by sleeping. Anything my roommates say or do makes me angry." A 57-year-old married male computer engineer says he gets angry a lot more and quickly. "I have no patience for anything or anyone. I snap at my wife more than usual. I don't have patience for her lack of technical skills on the computer. I also get angry with the news and lash out." I won't go into the model we have for anger management, but there is one which is effective in short-term counseling. Other people reflected the way that the lockdown had affected their ability to be effective parents. For example, my 2.5-year-old child has been really challenging to parent. "I find myself losing my temper more often than I would like, and I'm worried that I will lose the love of my wife and my family." Another mother talked about the problems of being on the phone and on the computer 9 hours a day while working from home. And yet when the lockdown ended in her area and the children were allowed to go back to daycare, she felt increased stress about sending them there. After a few weeks of counseling, the same mother wrote, "Thanks for taking the time to listen, comment, and make suggestions. I think even typing all this out in the past few letters has been a huge help for me. I have never done anything like this before, and I think that just the process itself had some learnings and realizations that I did not expect it would. The dramatic case of domestic violence in a 45-year-old insurance clerk led us to invoke a different protocol, because the cases are screened before being assigned, and an outreach call was made to assess her safety. But when it was clear that this patient could go through with online counseling, I continued to assess her safety, help her establish a safety plan. She was provided with emergency numbers. I continued to assess her readiness for change and helped her make a transition to local resources which were more appropriate. Grief was also a frequent complaint. This was one of my global clients who was a university professor working abroad. His 93-year-old father passed away during the pandemic, but because he was working abroad and because of quarantine requirements, he would be unable to attend his father's funeral. He wrote that he felt stressed, sad, disappointed, and frustrated, and it affected him more than he expected. In approaching grief, we help people recognize that grief is a normal response to loss. People are provided with psychoeducation regarding the normal stages of grief, as expressed by Kubler-Ross in her work on death and dying. We help people explore the meaning of loss. We encourage them to do the work of memory, which involves honoring and preserving the memory of the lost loved one. And we help guide them to local resources for longer-term guidance and support. One of my clients who received grief counseling during the pandemic writes, "Thank you for all your kind words. I enjoy going back and reading over them. Sometimes we are so hard on ourselves." Some clients chose to focus on the health effects of the COVID pandemic. One writes, "I wasn't healthy before. With COVID, I've put on even more weight. I have high blood pressure and I'm pre-diabetic and take meds for both." Again, she was encouraged to return to her regular family physician after expressing her needs and concerns in writing online. And stress in all forms, and this next story actually fits in many different categories, including anger and spousal conflict and so on. But the client writes, "My husband and I are working from home. Stress at home has increased dramatically with constant arguing, battles, and yelling. With my medical condition, stress plays a very big factor in triggering them as well as making them worse." So this is a 59-year-old bank clerk who identified herself as having fibromyalgia, migraine, and irritable bowel syndrome. And this unhappy triad points to a long and difficult life. And again, physical or sexual abuse in childhood are often associated with these conditions, and it requires considerable time and effort and listening to help people make sense of their lives and move on. But this, again, was part of the work during the pandemic year. So I'm going to end the presentation of the textual material here and just consider some future directions that this could take. Since I arrived in Portugal in 2007, I always wondered what the possibilities were for text-based online counseling here. I had the good fortune of being involved in the PAPS program in West Porto, in ACES West Porto in 2010. And this was a project for helping health professionals through a text-based online counseling service. Now, I don't know what happened since 2010. We had some early successes with a few workers coming into the program and receiving help from psychologists working in the ACES, but I don't know of any other text-based online ongoing programs in Portugal. So this is a thought for future directions, how this program might apply here. In conclusion, and I see that I'm keeping to my half-hour limit. Okay, one more minute to go. I would argue that online counseling provides an accessible, effective option during a pandemic. And this service may be valuable to specific segments of the population, for example, to university faculty and students. I believe that all the effective techniques that we have from in-person counseling can be applied online. And I believe that there is potential for application of this service in the Portuguese context. And I believe that this deserves to be studied further. So I'd like to thank you for your attention to this presentation. I'll be very happy to take questions or to hear your comments. on this.
Yeah, and thanks for your very interesting talk, mainly now in the times that we live. So we're open to questions.
Pode ser em português, se faz favor.
Do you prefer in Portuguese?
Tanto faz.
Professora de Mar?
Sim, eu gostaria. Parabéns pela sua apresentação, Iana. Muito boa e muito desafiante. E eu queria saber, assim, como você tem medido o sucesso do seu counseling?
Thanks, Aldemar. This was purely a subjective assessment. I did not use objective rating scales such as the Hamilton Anxiety or Depression scales with pre and post tests. I just looked at the text that people said that, you know, when they said, thank you, I appreciate what you did for me, I feel better, I've never had counseling like this before, I would take that as a positive response. When I got negative responses, people would say, I feel no better. I would like a referral to a personal counselor. Please send me on. This is not for me. I would take that as a negative response, but it was purely a subjective judgment. And it seemed pretty clear to me. I didn't have doubt about what was positive and what was negative. And again, if people dropped out and did come back, you could take that as a negative response, though we don't always know that. Sometimes in a follow-up memo, people would say, thanks very much, one was enough, I don't need to continue.
Okay, thank you. Thank you.
More questions? I have one. I imagine your answer, but what do you think that will be the future of e-counseling, mainly now after this experience with pandemic COVID-19?
I imagine that it will continue to grow. This company also offers chat counseling and kind of text messaging, which are brief, almost like an SMS, limited to 180 characters. That's not been as successful. People really, a certain segment of the population really enjoys the ability to expound at length on the issues that they face and to get a lengthy answer. They also have telephone counseling and video counseling, which have been quite successful, because there is a different segment of the population which really enjoys, as we're doing on Zoom, having a face-to-face contact with a counselor, being able to see facial expressions, to hear voice, and to get the reassurance, psychoeducation, or information that they need. I believe that this will continue to grow. Certainly in countries like Canada and Australia, where there are large, long physical distances, physical isolation because of the distances in the country, and horrible weather for a lot of the year, having easy access to a counselor is a huge advantage. Portugal doesn't have those disadvantages, certainly not in terms of the weather and in the physical distance between people, but I believe that there still is an advantage to having access to a counselor online. So simply it will continue to grow.
Thanks. Professora Margarida?
Olá, Cristina. Iana, thanks so much for your presentation. Really interesting. You know, distance is kind of a subjective measurement. You know, the Portuguese people think that from Lisbon to Braga is huge distance. It's just relative. But anyway, can you tell us a little bit more what are all the requirements and all the work behind a person becoming a counselor? Because I could not be a counselor, like a lot of people cannot be a counselor. Can you tell us a little bit more all the work behind training a counselor, and how do you follow up the counselors if they are doing, in fact, good work or not with people?
Great question. The company that I work for demands a master's or doctoral level degree in a counseling profession, such as social work or psychiatry, and there have been a few doctors working. I'm currently the only one on the service. So you have to be licensed by your professional association and carry sufficient malpractice insurance to work in this field. The company itself has a training manual and trainers who will work with the counselors with sample cases at the beginning and then follow. Now, this is interesting because it's one of the few professions where you can follow every word that was said between counselor and client. Often in traditional professions like psychiatry and social work, we do this by secondary elaboration. The trainee comes into the teacher and says, well, I saw a case on Friday which caused me some trouble. And the counselor says, well, what happened? Tell me about it. But you're only getting a secondary report of what happened. Here, like with a videotaped or audio taped consultation, you can see You can read every word that was written, and you can go back and say, well, I wonder why you said that. I wonder what would have happened if you had said something else, or what do you think might happen if you tried this? So as we talk in the book chapter on supervision, you can do very good supervision ongoing until the counselor is ready to stand on their own 2 feet. Now, I have a very competent and cordial supervisor who continues to follow my work after all these years, although I do this on a voluntary basis. And when I get stuck, and I do get stuck, I'm very happy to consult with my supervisor and say, I'm stuck here. What do you think? And she'll come back and say, well, what do you think? And we have this also done on email. We have this back and forth exchange to look at different ways of resolving issues where we get stuck. So supervision is possible as well. In Canada, there are actually university level programs at the master's level to train online counselor, and I can send you the link if you're interested. But people are able to sign up for these programs and learn online counseling in a formal university program.
Thanks, Jonas. Thanks so much.
More questions? Teresa Castanho?
Hello, John. Thank you for your presentation. I really enjoy it as a psychologist. So I have a question for you. I would like to know what were the difficulties that you find doing online counseling with older patients.
Well, certainly this requires literacy, computer literacy, and access to a machine. And we've discussed this in other Ciência, Falada and other presentations in our domain in population health, how we can help to train and increase computer literacy in the older population. But because I'm working with a select working population, so it's people between 18 and 65 until around retirement age, and people who have access to computer, that's not really an issue. If they find the link, sign on, go to the website, register for the service, that means they've already passed many of the obstacles which may inhibit others from using the service. So, but still there are issues, and I'll get people trying to do this from their smartphone, and I get blank messages, and then we have to troubleshoot until we find out where the bug is. But it's remarkable how few difficulties there are once people get online and fill out the registration form.
Okay, thank you.
More questions? Okay. There are no more questions, so I think we can finish now. Thanks a lot, Jan, and have a good week for all of you. See you next week. Bye-bye.